Hey guys, welcome back to my channel. If you're new here, please, you're welcome. Please remember to subscribe. If you've already subscribed, thank you for the continued support. Okay, to our topic today. Last time I did part 1 of infertility. Today I'm doing the second part of infertility, and I'm handling signs of infertility in both men and women, treatments, option for fertility for both genders, and how to prevent infertility. Okay, and to my first point, you see, signs of infertility are often related to underlying conditions. There are numerous conditions that can contribute to infertility in men and women. The signs and symptoms of infertility can vary greatly. If you are concerned, it is important to consult your doctor. You see, these signs, they vary depending with the couples. They're not the same to every couple, or to every man, or to every woman. So I'll be starting with the signs of infertility in women. Number 1 is irregular periods. You see, the average woman's cycle is 28 days, but anything within a few days of that can be considered normal. For example, you have a cycle of 28 days, then next time you get 27 days, the other day 26 days, that's okay. That can't be a sign. But a woman whose cycle varies so greatly that she can't even begin to estimate when her period might arrive is experiencing irregular period. For instance, this time around you have a cycle of 28 days, the other time you get 40 days, the other one 30 days. That's irregular. You can consider that as irregular. This can relate to hormone issues. It can be an issue of hormone imbalance. In that one, you can get help from your doctor. Number 2, painful or heavy periods. Okay, most women experience cramps with their periods, but painful periods that interfere with their daily life can be a sign of endometriosis. Experiencing the small pains that as a woman or as a girl experience, that's normal, but 2 painful periods can be a sign of endometriosis. You can seek help for that as a The other one is no periods at all. You're not having your periods at all. It's common for a woman to have a break here and there. You see, factors like stress, things to do with diet, having heavy workouts can cause your period to disappear. But if you haven't had a period in months, it's time to get your fertility checked. If you miss your periods once, twice, that's okay. But if you totally miss them, it's okay to go and take medical help. Number 4, symptoms of hormone fluctuations. You see, signs of hormone fluctuation in women could indicate potential issues with fertility. Talk to your doctor if you experience the following: skin issues, reduced sex drive, facial hair growth, thinning hair, weight gain. That's a hormone imbalance, and it is okay to seek help before things get worse. Don't assume that this is happening as this happens. No, seek help. The other one is pain during sex. You see, with this one, some women have experienced painful sex their entire life, so they have convinced themselves it's normal. It could be related to hormone issues, to endometriosis or underlying conditions that could be contributing to infertility. Yeah, don't convince yourself because you have painful sex exercise that it is not normal. It's not normal. Seek help. It's not supposed to be painful. Then I think I'll do that for women. Then for men, I have the signs of infertility in men. And number one, I have change in sexual desire. Yeah, a man's fertility can also be linked with hormone health. Change in virility, often governed by hormones, could indicate issues with fertility. For instance, a man maybe used to have regular sex regularly, but all of a sudden they have changed. Yeah, could be a sign of infertility. Then testicles pain or swelling. There are several different conditions that could lead to pain or swelling in the testicles, many of which could contribute to infertility. Yeah, feeling pain. It's not normal to feel pain. It's okay to seek help if you experience that. Then problems in maintaining erection. You see, erection is the hardening of the penis that occurs when sponge-like tissues inside the penis fill up with blood. So a man who is experiencing a hard time in maintaining an erect penis, that could be a fertility issue. Then issues with ejaculation. So ejaculation is the expulsion of semen from the body. Premature ejaculation is when ejaculation happens sooner than a man or a partner would like during sex. Inability to ejaculate is a sign that it might be time to visit a doctor. Yeah, being unable to expulse semen from the body, that's another sign of infertility. Then number 5, small firm testicles. The testicles house a man's sperm, so testicles health is paramount. See, testicles is where the sperms are stored. Small or firm testicles could indicate potential issues that could be explored by a medical practitioner. You see, all these issues, I'm doing 5 of them for men also. All these issues, you can seek help and get assistance. The other one now I'm doing is fertility treatment options for all genders. You see, if you are infertile, it's not the end of it. You can seek health assistance, and there are options where you can expand your family or give birth to kids through other methods. I'm doing like 4 or 3 of them. And the one is intrauterine insemination. It's commonly known as IUI. In this one, a healthcare provider uses a long tube to place sperms directly into the uterus. Yeah, the sperms are placed directly into the uterus and they fertilize the egg, and the woman conceives. Number 2 is in vitro fertilization, commonly known as IVF. In IVF, a type of assisted reproductive technology is involved. It involves harvesting the eggs at the end of the stimulation and placing sperms and eggs together in a lab dish. This is the one commonly known as test tube babies. You harvest the egg and the sperm, then you meet them in a lab dish. Then after that, the sperm fertilizes the eggs definitely. Then a provider transfers of one of the fertilized eggs, now it's an embryo, into the uterus, and the process of carrying a pregnancy starts. Number 4 is intracytoplasmic sperm injection. This one In this one, the procedure is the same with the IVF, where an egg is harvested and the sperms, then they are met, then the sperm fertilizes the egg, then the embryo is taken is transferred into the uterus, and the process of carrying pregnancy in a woman starts. Then the other one is third party. In this one, basically you use a donor egg. This is in the case where the woman is infertile, or a donor sperm in a case where the man is infertile, or donor embryos. Then you get from someone else or elsewhere or in a medical facility. Then some couples need a surrogate or another person to carry the pregnancy for them, and they give birth to their child. And they're in agreement that the baby is going to be carried by the surrogate belongs to this couple. Yeah, it's the third party act. Number 4, you can opt for adoption, where you go to facilities where they have kids and you opt to adopt a child and bring them as your own. It is still okay, and it is assistive in expanding the family. Then after I'm done with the options, I'll be doing the how to prevent infertility. See, men and women can take these steps to protect their fertility, especially while trying to conceive. If in that period where you're not using birth control methods and you're seriously looking for a baby, or you're seriously ready to conceive, you can exercise these steps during that period. It's crucial, it's important. 1, eat a well-balanced diet and maintain a healthy weight. Eat a balanced diet, don't be underweight, at the same time don't be obese or overweight during that period. Number 2, don't smoke or misuse drugs or drink excessively. If it's possible, don't use drugs at all. Number 3, get treated for STDs, the sexually transmitted diseases. You could be having the STDs during that period you're trying to conceive. It's important to seek treatment. Number 4, limit exposure to toxins. Maybe in the area where you live exposed to toxins like pesticides or such, you can relocate. Maybe where you work, get rid of them if it's possible. Yeah, and it should be possible. Then stay physically active, but don't overdo it. Yeah, do take part in physical exercise, but don't overdo it. Just do what is important. Just do enough. Just take enough exercises. Okay, eventually couples get pregnant after undergoing treatment. Success rates vary depending on the cause of infertility. The couple's age and other factors are factored in. Yeah, age is also a factor in being successful in conceiving. Yeah. Also aware that there are artificial uterus. Maybe yours was damaged or you totally don't have. If you are okay financially, at some point it's possible to get artificial uterus, but it's very expensive, and carrying a pregnancy using artificial uterus is delicate. You need to be in an environment which is favorable. Yeah, so if it's possible for you to maintain your natural one. Do it. Don't overuse the contraceptives. They position too. They damage uterus. Basically, they can do away with it totally. Yeah. Take care of yours. Yeah. Thank you for watching. See you in my next video.